U.S. Healthcare System Explained. The healthcare system is an essential determinant in promoting. Well, it also contributes a significant part to the overall economy and development of a country. Because an efficient healthcare system, if implemented correctly, helps in preventing diseases and improving quality of life. And the pandemics like COVID-19 made the necessity of a healthcare system more inevitable than ever. According to a recent study, an efficient healthcare system ensures a strong economy. And in fact, it provides a mere 10% increase in life expectancy, which leads to economic growth of approximately 0.4% a year. So, considering the importance of a healthcare system, it also becomes crucial to understand how this system works. Well, to help you in this regard, in this video we will be discussing the U.S. healthcare system in detail, and we will also go over some loopholes that are compromising the overall system. But before you learn about the U.S. healthcare system in detail, pay attention to the big red subscription button. As soon as you click it, you will be taken to the wealthy side, the life you deserve, where you'll find hundreds of videos. These videos contain the answers to almost any question you may have. There are also daily updates, so if you want to stay tuned, remember to turn on notifications. The United States has a population of more than 330 million people, and it is supported by one of the most complex healthcare systems around the world. It would not be wrong to say that this system is in a constant state of evolution. Although with the reinforcement of the ACA or Obamacare Affordable Care Act in 2010, around 10.4% of Americans remain uninsured. The U.S. healthcare system mainly relies on private sector funding, even though it is secondary to it. The breakdown of sources of payment is worth mentioning here. According to some estimates, public payers, including state and federal governments, account for about half of the overall expenditures in the healthcare sector. Well, if we get into the numbers, these are around 46%, and the remaining 54% is equally covered, as half of it is paid by the households themselves and half by the private third-party payer sources. There are other calculations as well that estimate that the public sources pay around 60.5% of total health spending. But if the federal tax subsidies for private insurance and government purchases of private insurance for public employees are taken into account, in other words, government funding of the healthcare system in the United States is significant. The system is built around the relationship between patients receiving care, payers, and providers. And the system consists of a patchwork of publicly and privately funded programs and systems. Also, the insured citizens are offered both private and public healthcare facilities. However, the maximum part is covered by the private healthcare programs, specifically through employers in the United States. In addition, some programs funded by the government, like Medicare and Medicaid, offer healthcare coverage to some vulnerable population groups. Even though the U.S. spends a lot on healthcare, it's approximately 17.9% of the GDP, or $3.3 trillion, according to the stats of 2016, which is $10,348 per person. This is far more than any other OECD country in the world, but, unfortunately, this large spending does not translate well to health outcomes. That's the reason the United States is not considered or not on the list among the countries with the best healthcare system. And it continuously ranks lower due to some measures that other countries with the best healthcare system take into account. The most prominent measures are the overall health of the population, life expectancy, and mortality rate. Mainly, the lack of universal coverage is an enormous challenge that results in inequality among all the population groups regarding access to healthcare facilities. Furthermore, the delivery system and the fragmented financing also lag behind other countries in the introduction of health information technology. But the amount spent on the system also made some positive results for the people who are insured well and are taking its complete advantage. The healthcare system in the U.S. contains a huge number of workforces that are professionally trained with quality medical specialists and exceptional health facilities and research programs. So, let's discuss some of the healthcare programs briefly that are currently available in the U.S. healthcare system. First of all, let's talk about the healthcare programs specifically that are provided by the private payers. As discussed, healthcare in America is largely owned by the private sector, and a huge number of people are in group plans that are subsidized somewhat partially by their employers. The remaining people that are not covered by their employer insurance plan have to buy individual private insurance that comes with varying premiums according to age and other deductibles. And these co-insurance and co-payments are 3 times higher than in the employer-sponsored market. Well, approximately 13.4% of the population which remains uninsured usually go to non-profit community health centers or emergency rooms for their medical requirements. They can access the emergency rooms with the help of the EMT-ALA, Emergency Medical Treatment and Active Labor Act of 1986. It binds the participating hospitals to entertain all the patients. However, this is just for a medical assessment and stabilization. Many people in the U.S. are part of group insurance plans by their employer or insured individuals that are enrolled in some kind of managed care plan. And afterwards, these plans contract with a network of service providers related to the health sector, which includes doctors, clinics, hospitals, pharmacies, and other medical equipment vendors who offer services to their customers. Enjoying till now? Please hit the subscribe button now, like, share, and comment. And yes, keep watching. Now, let's quickly go over to the recent Patient Protection and Affordable Care Act, known as ACA or Obamacare, which was introduced in 2010. This act was formed to provide enhanced health insurance coverage with insurance regulatory reform and the stakeholders' mandates to buy insurance. Eventually, it was passed after a vociferous debate in Congress with 4 major goals. The goals are to improve underinsurance, control overall expenses, expand insurance coverage, and improve the quality of health care. One of the essential features is the most controversial feature, which makes it mandatory for all citizens to have health insurance, otherwise they will be penalized. However, with this feature, the Act also provides subsidies for families by taxing high-income families or healthcare providers. The next most popular or well-known programs are the Medicaid, Medicare, and children's health insurance programs. Around 30% of the population is covered by these 3 publicly funded insurance programs. If we get into more details, Medicare is a national social insurance program that is managed by the federal government, and it is generally accessed by people with any disability and senior citizens or people who are the age 65 or older. The Medicare program is based on 4 parts, which cover different services. Medicare Part A is hospital insurance that is funded through payroll taxes. The second one is Part B, which offers medical insurance for covered medical services when they are medically necessary. And then comes Part C and D. Medicare Part C is known as Medicare Advantage, which provides you additional coverage. On the other hand, Part D provides you with prescription drug coverage. Whereas Medicaid is a state-based insurance program for people who are poor or with low income, well, the guidelines and partial funding are provided by the federal government in this program. It is funded and partially managed by states individually. According to some stats, in 2015, around 70.5 million American people were covered by Medicaid, which includes both adults and children. Moreover, the CHIP, Children's Health Insurance Program, is also a state-based program accessed by children up to the age of 19 from families with incomes too high to qualify for Medicaid. Well, this income varies from state to state. It can be more than or around 300% of the FPL federal poverty level. Now, we understand what healthcare insurance programs are available in the United States. Let's discuss how this system is performing and the issues that are arising in the system. Well, the U.S. healthcare system lacks when it comes to the utilization of EHR, electronic health records. This is somewhat also related to its inherently fragmented nature. Well, the High-Tech Health Information Technology for Economic and Clinical Health Act was designed to improve this gap in 2009. This act made the utilization of EHRs necessary for physicians and hospitals to keep their existing Medicare and Medicaid reimbursement levels. Additionally, being the highest by far of the 11 developed countries, one of the major issues with the fragmented healthcare system in the United States is that data collection is also fragmented, and it makes it difficult to find. And this system ranks lower when it comes to equity, efficiency, and indicators of healthy people in the country, in which it ranks last in 10 OECD countries. There are also other things to consider which contain the continuation of programs, cost to patients and other payers, and uncontrolled coverage that results from many companies providing many different plans. Another rising issue that is related to U.S. healthcare is that the system is becoming consolidated. because more and more physicians are leaving practices and becoming employees of big corporations. According to some statistics, in 2013, only 36% of physicians were in private practice, and this number dropped from 57% in early 2000. And that leads to more issues, like increasing the rate of physician employment and higher prices as the hospitals are buying physician practices at an increased rate. Moreover, another important thing to consider here is that in other countries, healthcare facilities are mostly owned by governments or by private sector businesses. Whereas in America, a huge share of clinics and hospitals are owned by nonprofit organizations. That's why the U.S. health system does not offer healthcare to its complete population, unlike most developed countries. Because there is no single system that is implemented nationwide, and the U.S. mostly relies on employers who provide health insurance coverage to their employees and dependents, new problems are consistent. Also, the rising pharmaceutical prices, specifically the addition of super high-cost drugs, affected the healthcare cost structure badly. The number of patients who are using specialty medicines for a cumulative high cost annually. Approximately 140,000 Americans have annual drug costs of over $100,000 per year. And you will be surprised to see that the healthcare costs in the U.S. are one of the key reasons many Americans file for bankruptcy. According to a report on CNBC, 2/3 of people in the U.S. who file for bankruptcy cite medical problems as the major contributor to their financial crises. However, there is some news coming that physicians for a national health program are advocating for a national Medicare for All program that will eventually broaden the insurance coverage for the people of America. The U.S. healthcare system is a great debate across the country. We have provided a wider picture of this system and mentioned problems that are arising or associated with it. What are your thoughts, or what do you think about how the U.S. healthcare system can be improved? We would love to hear from you. Did you enjoy the video? Please hit the subscribe button, like, share, and comment.